Invite our really spectacular speakers today. We have Melissa Willa, who is co-founder and chief clinical officer at CAIO, an agency that provides ABA therapy to children and young adults with autism. Melissa is a board certified behavior analyst and is also a former elementary and special education teacher. She obtained her bachelor's degree in elementary and special education from the State College of New York at Geneseo, and she earned a master's degree in behavior disorders from Teachers College, Columbia University. Melissa co-founded CAIO with her partner, Colin, 16 years ago. At CAIO, Melissa provides strategic leadership around evidence-based practices that improve patient outcome. Melissa is particularly interested in methods that are highly motivating to clients and easy to implement for staff and caregivers. With effective and efficient treatment serving as her guiding principles, Melissa focuses on making every moment count for kids and for families. Along with Melissa, we have Sage Howard. Sage is our Senior Director of Clinical Integrity, as well as a Compliance Officer here at CAIO. A board certified behavior analyst, Sage received her bachelor's degree in theater arts from UC Santa Cruz before changing course and completing her master's in early education, special education at Hunter College in New York City. Sage has extensive experience providing behavior analytics services in the home, community, and school settings. And with that, I am going to hand this over. And again, if you have any questions along the way, feel free to type those in the chat and I will monitor those for you. Thank you.
Hi, everyone. Welcome. We presume that most of you who are joining us today are parents and that your child is either currently receiving ABA therapy or you're considering starting ABA therapy, and you're asking some questions and wondering how to determine if your child is making optimal progress or if they're starting therapy soon, how to tell in the future if they're making optimal progress with this approach to therapy and with the team that you have in place. So Sage and I are going to offer you some tips for how to measure that level of progress, because we know this can be a challenge. We are going to offer you some guidance in terms of how to think about your child's therapy goals and also how to think about their progress as it relates to standardized assessment, the Vineland Adaptive Behavior Scales, as this tool is increasingly required by health plans to measure ABA treatment efficacy. We also believe that parents have a right to transparency of their child's treatment results, not just in a report once every 6 months, because that's what the payer requires, but frequent updates in a modern and convenient format. So we'll talk a little bit about how we do that at CAIO. Overall, we really love providing practical advice to families and clinicians. So we hope you walk away from this talk today with some practical guidance that you can take back as you think about your child's therapy. Jagmeet, do we want to go back and did you want to introduce the team a little bit more?
Oh, sorry, go ahead. Sorry about that hiccup, but we can go ahead and get started from here.
Okay, and then
I can come back.
All right, great. So we're going to start off with this essential question, and that is, how do I know if my child's ABA is effective? And this is a difficult question to answer because we know that all individuals with autism are unique and all respond in different ways to treatment, with some children making very quick progress and others taking more time, others needing greater repetition and practice of new skills. But in the end, there are some really important signs to watch for to determine if ABA therapy is worth continuing for your child or with that current team that you have in place. So we'll ask this first question of, why are we here? Folks like myself, Sage, and Jagmeet, we're all board certified behavior analysts. We're BCBAs, and like fellow BCBAs on the call and who work in the field, we got started with this approach because we wanted to make a meaningful difference in the lives of children and families. And we found an approach that is highly effective for kids on the autism spectrum. But we are here to improve children's abilities and independence in lasting ways. So we're not looking to improve our clients' progress just in therapy sessions with us, but more importantly, outside of therapy sessions with their families at home, in the community, in their schools. We are here for a child who, for example, engages in solitary play with their vehicles that they love, but doesn't yet engage in any play activities with their sibling. We're here for the child who can't yet sit in class next to peers during circle time. And we're here for the family who wants to be able to take a vacation, maybe go to Disneyland, but is afraid of the plane ride and all of the transitions. So one of the first questions I encourage you to think about is, what is your child's emotional response to therapy? Years ago, decades ago, there was more of a belief and that ABA therapy, first and foremost, needs to teach children to sit quietly, look you in the eye for extended periods of time. And there was a lot of talk from parents who found ABA to be successful about how, well, their kid was miserable for the first few months, but that's just to be expected. And now that they can comply with the therapist's demands, they're, engaging compliantly with the tasks. That's really not a modern way to be thinking about therapy. It's really not okay. We don't want kids to be unhappy for days or weeks or months with therapy. If ABA therapy is done well and done right, your child should be happy from the beginning. Of course, it takes a little getting used to any new person who comes into your home or in a center, but really you watch for that excitement, that motivation, that your child is having fun during therapy. That's what good ABA is all about. You should see that your child is motivated by the tasks that are being presented, and maybe not every single one. And there's going to be protest behavior, because whether your child is neurotypical or a child in the spectrum, all kids engage in protest behavior at times. But you really want to look for a happy child. We know that kids who are motivated to learn will make better progress. We're also encouraging you to just think about your own family stress. So with ABA that is benefiting your child and working, the family should experience a nice side effect of parents feel more well equipped to understand why challenging behaviors are occurring, what they can do to prevent future occurrence of behaviors. Seeing their child headed in a positive direction, making strides, generally has a nice after effect of helping to reduce stress across the whole family unit. You also want to think about how often your child is achieving short-term objectives and long-term goals. So you should be seeing that your child is mastering a number of short-term objectives every week that they're in therapy. And that might look like your child is progressing from needing one level of prompting to a less intrusive level of prompting. And perhaps they're learning additional words in their vocabulary to make requests or name. But you should see progress happening consistently, and long-term goals that are being mastered. The majority of your child's long-term goals should be mastered every 6 months. One of the things that Sage is going to talk a little bit more about, and why a standardized assessment like the Vineland is so important, is we also know that goals are somewhat subjective. And so a clinician could write a goal in a manner that's just low bar, easy for a client to master in 6 months. And then that wouldn't really be as helpful to us understanding, is that all that could be expected from the child in terms of progress, or could more have been achieved? Which is why standardized assessments are needed to balance that out. But also think about, are your child's goals the right goals? First, are they developmentally appropriate? So this is one of my biggest pet peeves when it comes to ABA goals that aren't appropriate for a child, maybe due to my background in typical child development and elementary education. But you want to make sure that the therapists who are designing your child's treatment program are designing goals that are not above and beyond what would be expected of a typically developing child, and that are following that natural progression of child development. If your child cannot yet say, red car or a big truck, we wouldn't want to be teaching them how to say, I want the red truck, please, or I want truck, please, because that's not how children develop language. It's not mindful of that natural progression. An example of a developmentally appropriate goal would be a 2-year-old who's being taught by their ABA team to imitate play-based movements with objects, rolling a ball, painting with a paintbrush, pushing cars down a ramp. Those are very developmentally appropriate. What would not be developmentally appropriate is a treatment plan that has a 4-year-old learning to read sight words. Now, I taught my kids to read at an early age, but that was not medically necessary, something I chose to do. Medically necessary ABA is targeting those goals that we're really looking to close the gap, the developmental gap. And so sight words wouldn't be something that we'd be teaching a 4-year-old. Now, for a 15-year-old who goes out in the community and can't recognize the word stop or exit or men or women on a bathroom door, and there are safety issues in the community when they can't recognize the word stop or walk or don't walk, then that may be, for that child at that point, learning sight words would be appropriate, developmentally appropriate goals. Another non-example maybe would be in the realm of behavior. If your therapists are targeting a behavior such as protest, they've been targeting it for a few years and you're not seeing that goal achieved, you really have to look at, is the goal in and of itself appropriate, and are the tactics being used appropriate? There was a treatment plan that Sage and I looked at where a child was being asked in the course of the treatment plan to engage in, I think it was fewer than, one verbal protest per ABA session. Now, ABA sessions are generally 2 to 3 hours in length. And this kiddo made awesome progress the first 6 months and was going from like 14 instances of protest down to 2 instances of protest per session. And then just sort of stalled out at 2 instances. And, Sage and I talked, and we both have children, and said, did your kid engage in a couple of times of protest an hour with you? And oh yeah, our typically developing kids engage in that level. So, the therapist in that case had failed to realize they had already gotten that child to what would be typically developmentally appropriate. Think about, are the goals socially significant? Are they important to your child? Are they important to your family? Will they result in your child being able to access greater opportunities for social interaction in their natural environments, in school, in the community, and in your home? Are the goals getting your child to a place of meaningful progress? ABA therapy, by definition, must result in meaningful progress in order for it to be considered effective. So this may mean different things for every child, but some examples are a child who can't say mama or dad and learns to say mom, learns to say dad, learns to call their sibling by name or ask for help when needed. For another kid, that might be the ability to walk into a restaurant, sit down at the table, sit quietly during the meal, order food, and have a pleasant night out, dinner with their family. Non-examples in terms of meaningful progress would be a child who has the same behavior reduction goals in place for multiple years, or the same expressive language goals in place, or who's learned to imitate objects only when provided with a physical prompt from the therapist. If skills are not being taught to independence, you do want to question whether or not the approach ABA or what's happening during sessions is right for your child. And then one more question to ask and think about with goals is, do these goals help to pave the way for success with other future goals. We call these pivotal skills. And this comes from the Kegels, who are professors at Stanford who developed an approach to ABA, falls under the ABA umbrella, called pivotal response treatment. There are certain skills that when you master them, open the doors for children to more naturally acquire and more independently acquire new skills. So for example, turn taking, joint attention, imitation, those are all skills that once they are developed can help a child to learn additional skills. So I'm going to turn this over to Sage in a moment, and she's going to talk about how to understand if your child is making progress on a standardized assessment, and specifically the Vineland. So your ABA provider, if your child has ABA therapy, should make these scores exceedingly clear to you every reporting period, which is generally every 6 months. And if your child is not making progress on the Vineland, you should have a conversation with your provider about why not. Are the goals not appropriate? Or, look at the team composition training. Is it a therapy dosage issue? Is the utilization of hours correct? Some kids respond very, very well to ABA therapy, and then others, take more time to learn skills. And for some children, that rate may not be sufficient to meet the criteria for medical necessity. So Sage, I'll turn this over to you now. I know you want to share some additional info with the folks who are calling in today about the Vineland and how to interpret scores.
Thank you. Yeah, so we are going to spend a few minutes talking about what the Vineland is. Why do we at CHIO feel that it's a pretty important part of our ongoing assessing and treatment planning, and kind of as a parent, what you can expect it to look like, and tying back to the goal of this webinar, what sort of improvements should you be looking at when you're presented with these scores? So what is the Vineland? So as Melissa said, it is a standardized assessment tool. It is very widely used. So, it can be used as part of a diagnostic process. So we do see often that families may have just gotten a diagnosis, and as part of that, they will have gone through the process of completing a Vineland, and then they will come over to us where we will be using the Vineland, more for programming and treatment planning and being able to measure progress. And so when we talk about this idea of adaptive skills, why do we care about that? Why is that something we're paying attention to? It's really, really important that we think about the difference between being able to do something and actually, being capable of doing something, and actually having that be a skill that you demonstrate at the appropriate times regularly. So if you think about, especially, a lot of our children with autism that we work with, we know there can be some issues with generalizing skills across different locations or with different people. So a child who is capable, has the actual skills of using a fork to stab their food and eat it, is different than a child who, when they sit down for a meal, goes ahead and picks up their fork and eats their meal with the fork without prompting. In the same way that someone, a child who may be in a center is receiving services and it's nice and quiet and it's sterile, and they do a great job at responding to one-step directions. But when they're in their home and mom is saying, go get your shoes, they're not actually demonstrating that skill at the times when it's appropriate to demonstrate. And so the Vineland, the way that it is set up is to really try to probe with a caregiver, not is your child capable of demonstrating these skills or performing this skill, but do they regularly demonstrate this skill at the times when it is appropriate to do so. So it's conducted in what they call a semi-structured interview format. And the way that it is really meant to be administered is as a conversation. So one thing to pay attention to when your BCBA is sitting down with you to administer this is, are they just sort of running through a list and saying, the options are always, sometimes never, does your child identify 10 body parts? Does your child respond to 5 directions when you give them? Always, sometimes, never. That's not going to give us as reliable of answers and as good of a picture as more of a conversation that says, let's talk about, Johnny's ability to respond to directions, and let that caregiver start to just talk, and you're going to start landing places, and a skilled BCBA or administrator is going to be able to see, oh, I saw, as part of this conversation, mom actually just told me that Johnny is never responding to 3-step directions, and they're sort of able to start going and coding that. It can be lengthy depending on the age of the person that you're talking about, depending on the skill level. The assessment is going to kind of keep building until you reach a ceiling where it becomes pretty clear that you're talking about skills that this learner does not demonstrate yet. So, I usually like to tell people plan for at least 30 minutes, and sometimes that can go a little bit longer. And so the Vineland is broken down into domains. The 3 main domains that they are looking at, which really encompass, pretty much all of somebody's functioning. And we'll talk about a couple, other domains that they include as optional options, are communication, daily living, and socialization. And so within that communication domain, we are looking at expressive language. So the ability to communicate, whether it's going to be for your child, is that going to be spoken verbal language or sign language or some sort of AAC device, but the ability to expressively communicate, receptive communication. So things like those instructions following, stuff like that. And then written communication as well, depending again on the age of the learner and when those written skills would, in a typically developing child, become appropriate. And then within the daily living, we're looking at personal skills. So things like being able to dress and feed and toileting, community, being able to go into a grocery store, again, when that is an appropriate skill for somebody that age, and make purchases, keeping yourself safe, domestic, helping around the house. My children would score very low on this one. Cleaning up after themselves, helping with the dishes, stuff like that. And then, over in the socialization, we're talking about maintaining friendships, initiating conversations, depending again on the age, engaging in parallel play, imaginative play, interactive play, and then also those coping skills. So being able to handle changes in routine, things not going your way, losing a game, stuff like that. And the Vineland does also offer optionally motor skills. So if that's an area where you have concerns about your own child's functioning, that is something that can be administered. It does not have to be administered in order to score the report. And it also offers a section around, they call maladaptive behaviors. And so it looks at internalizing and externalizing behaviors. So sort of those withdrawing behaviors, and then those kind of more explosive behaviors. So what do you want to look for? The idea with the Vineland is that once it has been administered and once it has been scored, it is going to give the BCBA a picture of where the deficits are. So they're going to be able to see certain domains and certain subdomains where there is probably a need to focus more of the treatment. And so when you're looking at your child's whole ABA treatment, what you really want to see is that you have a BCBA who is taking the Vineland scores into part of their treatment planning. And then they're also taking the conversations that they have with you as a parent, and they're taking the data that they're collecting every day during the sessions, and they are using that holistically to really identify and fine tune where are the areas where we need to focus our time and focus our treatment. They should be meaningful for you, and they should be meaningful for your family. So sometimes the Vineland is going to say, hey, a typically developing child of this age should be eating with a fork. You're saying you're never eating with a fork. But guess what? there are some cultures where that's actually not appropriate, or there are some families who are going to say that's really not a priority to me. And so you want to make sure that your BCBA is taking all of these into account and making sure to work with you in developing these goals that are really going to be impactful and socially significant for your child and for your family. Like Melissa said earlier, you really want to see that goals, short-term objectives are being met. You don't want things that are just kind of lingering and treatment forever and ever. That means that your BCBA needs to make some sort of an intervention. Something is not working. Maybe the goal isn't written clear enough to be run well. Maybe there's some precursor skills that we actually get in and start working and realize, oh, before you can do this, we actually forgot that we need to teach you this. We missed this little piece. Ideally, you want to see that what we call our long-term goals are being achieved within a 6-month time frame. That is something that your insurance is going to really, really want to see. And that is something that we strive to make sure that our BCBAs know, that you want to be developing goals that aren't these huge reach goals that are going to take 6 years to achieve, but you want to try to break that down into something that can be achieved within about 6 months. That's not always the case, but if you are never seeing that, that should maybe raise some red flags for you. And when we talk about the Vineland, what do you want to see? You want to see that your child is making progress, right? In at least one domain. Sometimes the results from the last Vineland are going to tell you and your BCBA, we really need to focus on this area. So maybe we really need to focus on communication over the next authorization. And so maybe there aren't a lot of goals developed around daily living. And so you don't see a lot of progress in that domain from that administration to the next, because your treatment team is really focusing their energy on those communication skills. But you want to see some progress, right? And ideally, and earlier we had a little screenshot of some scores over time. Ideally, you're seeing them. Wouldn't it be great if they're all going up at this rate? More likely they're probably going a little bit of a more shallow slope, but you're seeing some sort of steady progress, and you're not seeing here, oh, this time we're up here, then we're down here, then we're up here. When you see things like that, it should cause you to wonder, is there something going on in the administration that is maybe not capturing my child's actual skills? And so, as Melissa said earlier, we really, really feel that it is important to be really transparent about how our clients are doing with their families. We don't want to have anything hidden from them. And so one thing that we have done is that we have made these results, all of these scores for the Vineland, as well as goals achieved, very, very easily accessible to parents through our CAIO Care portal, which all of our families use for scheduling and as well as some other things. But so obviously there should always be conversations with the BCBA. The BCBA needs to be presenting these results, but families can also at any point log into their portal, and they can easily see here. You can see these +9, +6, +15. This is somebody is doing really, really well in treatments, and they have gone way up in every one of the domains between their Vineland administrations. But it's a really easy way for families to always be involved. And to be totally frank, it really holds BCBAs accountable to know, hey, families are going to see this. They are going to, every day when they log into this portal, they are going to see which goals have been mastered in the last week and how their child is doing on the Vineland. And so it really sort of holds our BCBAs accountable to make sure that they are really keeping those outcomes in their mind, that outcome-focused treatment planning as they develop their goals and as they supervise these cases. Melissa, is there anything else that you want to add? Oh, we're already at 12:31. Oh my goodness. Sorry if I talked too long. Is there anything we want to add?
Yeah, no, I think that you covered it, Sage. I wish we had more time for Q&A right now. I'm happy to stay on for a few more minutes for those folks that have some more time. Jagmeet, I know you wanted to maybe close the loop on a few things, and then we'll take some questions from those participants who are able to stay on a little bit longer.
Yeah, absolutely. Thank you, Melissa and Sage. That was just so fantastic to hear about, number one, what you should be looking for and how parents can really be in that driver's seat. So as Melissa mentioned, please go ahead and type in your questions if you have any at this time. But we here at CAIO provide in-home, home-based ABA services, and we also provide services in school settings. And we want to be where you are, where your child is. So being able to also provide that in the community and be very naturalistic in our approach to help capture some of those learning opportunities. We have many, many locations on our website. You can see where you are and find an office close to you. And I also mentioned earlier that if you had questions specifically about ABA, whether you're a parent wanting to know more about ABA services, or you're a professional and you want to get to know how you can bring ABA training to your teams or to your organization, schools, preschools, daycares, you can always sign up for a free consultation by one of our BCBAs here.